एयरपोर्ट देख लिए हैं आपने? मैं आ जाऊं? एयरपोर्ट है क्या इधर मेरी?
यस क्लास स्टार्ट हो रही है आपकी।
यस हो गई बस
जल्दी से लॉगिन करो, फोटो लो, बाप को
रिक्वेस्ट ऑल द स्टूडेंट्स टू टर्न ऑफ योर माइक्स
बड़े बदतमीज हैं।
उस दिन यमुना से एंड शर्मी ऐसा बोल रही थी
सुनाई।
हाँ लग गया
Hello, ma'am. We can wait for another 2-3 minutes, like around 6:05. We can start the class because students are still joining.
Okay, sir. All right.
And I request all the students to please turn off your mics. Please turn it on as and when required or whenever the lecture asks you to turn it on. Otherwise, please turn it off.
Excuse me, ma'am. Hello.
Class has not yet started.
Actually, I want to know if this is the third class or fourth class, sir.
This is the fourth class.
We weren't aware about the third class. We didn't get any link nor the video, so.
Surely you will get the PDF of that class because that class has not been recorded. So
Okay.
those students who didn't got the recording of third class, will send you the PDF of that thing. We don't have the recorded class, the third class one.
Okay, so we should follow up with the fourth class now.
Yes, you can.
Okay, thank you.
Dr. Sneha ma'am, we can start the class now. And I request all the students to please turn off your mics. Turn it on as and when required, or if the teacher asks you to turn it on, then only turn it on. Otherwise, keep it off. Okay. And please cooperate in the class.
Mhm. So good evening. Good
Good
evening,
evening, ma'am.
students.
Good morning.
Good evening,
Good
ma'am.
evening. So today we are going to deal with the fourth class. So this is actually a different class, where we deal with the planes and movements of different parts of the body. Some basic concepts about that. Okay. So no need to worry if you didn't get the third class topics. So I'll be telling some of the things about the third class also. Okay. So if you can follow it, just keep it along with, or else you'll get the PDF as sir mentioned. All right. So we'll go to the class as of now. So I hope that you have already read the second and third class well. So we'll start up with today's class. Okay. Yes. Yeah. So today we are going to study about anatomical planes and movements. Okay, so there are so many terms in today's class, so please pay attention to it. Okay. So first one, we are going to study about the anatomical planes. Okay, so three fundamental positions or planes are there in anatomy. One is sagittal plane, sagittal plane, coronal plane, and transverse plane. So what each plane is, we'll deal it one by one. So mainly three fundamental planes are there. I have mentioned four planes. Okay, I'll tell you which one are the three fundamental planes in the coming slides. So for the time being, just remember we have a mid-sagittal plane, sagittal plane, coronal plane, and transverse plane. Okay, so just a minute. Yeah. So please kindly chat if you have any doubts. Don't do unnecessary chattings. Okay. Yes. So first one, we are going to study about the mid-sagittal plane. So this is actually a plane which divides the body into, sorry, this is a plane which divides the body into equal right and left halves. When you look at this picture, you can see that this red color plane, which is passing through the center or the midline of the body, which divides the body into equal right and left half, is called as mid sagittal plane. Okay, so mid sagittal plane is the plane which divides the body into equal right and left half. So all these are imaginary planes. Okay. Then, so coming, look at this picture, you can see a dark green colored line, which is the mid sagittal line. As you see, it is dividing the body into equal left and right halves. So you can see another line which is parallel to the first line. Another line which is parallel to the dark green colored line, that is the parasagittal plane. Okay. So if you see, you can see the difference that the parasagittal plane, also called as sagittal plane, divides the body into unequal right and left halves. So the difference between mid-sagittal plane and parasagittal plane is that mid-sagittal plane divides the body into equal right and left half, whereas parasagittal plane or sagittal plane divides the body into unequal right and left halves. Okay. So first plane we studied was mid-sagittal plane, which is a red colored line that is shown in the image. And the second plane, which you can see in dotted way, is the sagittal plane or the parasagittal plane. So any plane passes parallel to the mid-sagittal plane, which divides the body into unequal right and left halves, is called as parasagittal plane or sagittal plane. Okay, so when somebody is asking you which plane that divides the body into right and left halves, you have to ask the question that please be specific if it is equal right and left half or unequal. If it is equal, it is mid sagittal plane. If it is unequal, it is sagittal plane, also called as para sagittal plane. Okay. See, can all of you hear my voice?
Yes, ma'am.
Yes, ma'am.
Yes,
Yes,
ma'am.
Ma'am.
Yes,
Yes,
ma'am.
ma'am.
Okay, yes. So that is its sagittal and mid-sagittal plane. So commonly, we actually don't use the mid-sagittal plane in a common way. We also actually use the sagittal plane in a common way. When we study things and all, we normally say it is sagittal plane. Okay. So the three fundamental planes, one of the plane is sagittal plane. Then the next plane is coronal plane. This plane, as you can see that this plane divides the body into an anterior part, that is the front part, and the posterior part, which is the back side of the body. Okay. So any plane which divides the body into an anterior part and a posterior part, it is called as coronal plane. Okay. Then the next plane is the transverse plane, also called as horizontal plane, also called as cross-sectional plane, which divides the body into the superior or the upper part and the inferior or the lower part. Sorry, inferior or the lower part. Here you can see that this plane, which is marked in red color, divides the body into an upper part and a lower part. So upper part anatomically we call it as superior and lower part we call it as inferior. So that plane is called as transverse plane, which is also called as horizontal plane, also called as cross sectional plane. Okay, so three fundamental planes of human body: one is sagittal plane, coronal plane, and transverse plane. So when you see in detail, sagittal plane is divided into sagittal proper or parasagittal plane and mid-sagittal plane. So mid-sagittal plane divides the body into equal right and left half. Parasagittal plane or sagittal plane divides the body into unequal right and left halves. Is it clear till now?
Yes, ma'am.
Yes,
Yes,
ma'am.
ma'am.
Yes, ma'am.
Ma'am.
Excuse me, ma'am.
Yes, ma'am.
All right, children, all right. So now I have a question. Can you answer which plane is this?
Mid-sagittal plane.
Mid-sagittal
Sagittal
plane.
plane.
Sagittal plane.
So we normally say it is sagittal plane, but to be more specific, which plane is that? It is mid-sagittal plane. So you can say that it is passing through the center of the body. So the answer is, normally we say sagittal plane. Okay. So which plane is this?
Coronal
Coronal
plane.
plane.
Coronal plane.
Coronary plane. Coronary
Okay.
plane.
Yes, it's coronal plane because the body is divided into anterior and a posterior part. So
Posterior
that is
part.
coronal plane. And which plane is this?
Transverse plane.
Transverse.
Transverse.
Transverse plane, also
Huh.
called as horizontal plane,
Horizontal plane.
also called as cross sectional plane. Okay, so these are the three fundamental planes of human body. Just a minute. Yes, so the mid, somebody has asked, is the mid sagittal plane and the median plane same? Yes, both are same. Okay, so we normally say mid sagittal plane as median plane. Both are same since it is passing through the center of the body. So the next one is, so now we are going to study about anatomical movements. So before studying that, you have to know that which part, where does the movement takes place in a body? Can anyone answer me? Where does the movement takes place in a body?
At the joints.
Very good. So
At
it
the joint.
happens at the joints. Okay, so movements occurs at various joints, and movements are described in relation to some axis or a plane. Okay, so which axis, which movement takes place, that much detail is not needed as a UG student. You just need to know about the different types of movements in the human body. So movements always takes place at a joint. That idea you have to keep in your mind, and we'll study it one by one. Sorry. The first movement we are going to study about is flexion. So the first movement is flexion. So flexion means it is a bending movement. So anywhere in the body a bending is taking place, that movement is flexion. So what is flexion? It approximates two surfaces of the adjoining part. Adjoining part, that is very important. It approximates two surfaces of the adjoining part. Okay, so now we look at the example of an elbow joint. Now all of you look at this picture. First picture, you can see that elbow joint. You can see this is the arm of the patient and this is the forearm of the patient. Okay. So when you do flexion, what is happening? The two adjoining surfaces, that is the arm and the forearm, is coming close together, and that movement is called as flexion. So what happens during a flexion? This was normal angle of elbow joint, whereas in flexion, the angle of the joint reduces. So flexion always takes place in which plane? It is happening in the sagittal plane. Okay. So what is flexion? Flexion is a bending movement. Any body, if bending is taking place, it is called as flexion. So what happens during flexion? Two adjoining surfaces comes close together. Two surfaces approximates. And what happens during approximation? It reduces the angle
Angle.
of the
Joint.
sorry. Yeah. So it reduces the angle of joint. So we have seen the example of an elbow joint. Now we'll see various examples. Now look at the shoulder joint. You can see that this is the shoulder joint and this is the angle of shoulder joint. So for flexion to take place, to which part does the hand move? To which side is it? Should it move to anterior or should it move to posterior?
Anterior.
Anterior.
For flexion to take place, so all of you say that it has to move anterior, and what you have said is correct, because when it moves anteriorly, then only the ankle will reduce. What happens? It moves posteriorly, the ankle will not get reduced, the ankle will increase.
Increase.
Okay, so the flexion of shoulder joint is moving the hand forwards, is the flexion of shoulder joints. Here you can see this was the ankle of shoulder joint, whereas in the second picture, when it moves forwards, the ankle has been reduced. So now the second question. Look at the knee joint. Okay. So this is the normal position of the human body, which is the anatomical position. And you can see the ankle of the knee joint. So for flexion to take place, to which side the leg should move?
Posterior.
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 Should it move posterior?
It's a posterior.
Should it move to the front or should it move to the back?
Back.
To the back.
For flexion take place, what was flexion? Two surfaces has to come close together and the ankle has to be reduced. So for knee joint to undergo flexion, it has to move backwards. And backwards, the term we use in anatomy is posterior. So can you see flexion in knee joint? Yeah. So that's the difference. So somebody is having a chat. Just a minute. So what is somebody is having a voice problem? Can all of you hear my voice clearly? Is there
Yes,
any
ma'am.
break?
Ma'am.
Yes, ma'am.
Yes. So if you can't hear the voice, can you just refresh and join once again? Can you try that? If those who are not clear about my voice, please try that. Okay. So knee joint, you can see the flexion is moving the knee joint. posteriorly. Okay, so please don't use the slides. Please don't use it. Please don't use it. Okay. So to study about something called as extension. So extension, what do you mean extension? It is the opposite of flexion. So what happens during extension? There is an increase in the angle of joint. So the first picture you can see that the elbow joint was in flexion, so which we have studied already. So for extension to take place, it has to move backwards, or here you can see the
Backward
flexion.
posterior.
Ah, yes, it has to move posterior. So here you can see that the elbow joint has been extended and the angle of the elbow joint is increased. Okay, so that's next picture. For the shoulder joint to undergo extension, whether it should move anterior or posterior.
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 So the second picture, you can see that it is the extension of shoulder joint where the shoulder joint angle has to move posteriorly and the angle has increased. Okay. So in upper limb, move forwards or anterior is the flexion, whereas moving backwards is the extension. Now coming to the trunk flexion. So here you can see that this man is bending forwards where there is a decrease in ankle, that is flexion, and the man is undergoing extension. The second picture shows the trunk extension. Okay. So where is the and joint here in the trunk extension and flexion? Where is the joint? At which joint it will be acting?
Hip
Trunk,
joint.
ma'am. Hip joint.
Hip joint.
A separate entity. For a trunk has to undergo flexion and extension. The joint involved is the joint between the vertebral bodies. You know, vertebra is present in the posterior part of the body. So the vertebra is having a joint, that is a vertebral joints. So the movement is happening at the level of vertebral joints. So don't think that the trunk extension and flexion is happening at hip joint. Hip joint, there is a separate kind of movements. For trunk flexion and extension, the joint movement is happening at the level of vertebrae. Okay, that is why we have the pair of vertebrae. So now coming to the knee joint, the first picture you can see the knee is in flexion, and when it is back to its anatomical position or when it moves backwards or forwards, it is the knee extension. So can you see the difference in the upper limb and lower limb? In upper limb, this was the opposite, whereas in lower limb, the opposite of upper limb is the extension in lower limb. Okay. So hope you get it. Flexion, always remember, flexion is a bending movement. Anywhere bending is happening, it is flexion. So what happens during flexion? There is a reduction in the angle of joint, whereas in extension, it is the opposite of flexion. And what happens during extension? There is an increase in the angle of the joint. Okay. So coming to, so is it clear till this? Is there any doubt?
Yes, ma'am.
Yes, ma'am. Clear, ma'am.
Clear, ma'am.
Okay. So coming to abduction. So abduction. So anywhere abduction means movement of any part away from the midline of the body. So here you can see in the first picture, the man is standing in anatomical position. In the second picture, he is moving his arms or the upper limb away from the body. And that movement is called as abduction. So you can see the midline here, it is a red color line passing through the middle is the midline. So anywhere you move the part of the body away from the midline, that is abduction. So always remember, abduction means away from the body. It should not always be from the midline, it is away from the body, always means that it is abduction. Okay, so keep that in your mind. So first picture, this is hip abduction. So the first picture, you can see the man is standing in anatomical position. And the second picture, he is moving his lower limb away from the body. And that's hip. Second picture shows the hip abduction. So the movement is happening at the hip joint. The second picture shows the hip abduction. Okay. Then coming to the fingers. So we have 5 fingers. where the black color line is passing through the middle finger. So that is the midline in the fingers. When you move the fingers away from the middle finger, that is abduction. So for fingers, when it moves away from the middle finger, it is abduction. Did you get that? When you move the fingers from the midline, away from the midline, that is abduction.
Abduction.
Yes.
Yes, ma'am.
That is finger abduction. So coming to the opposite action of abduction. So what is the opposite of abduction? It is, sorry, it is
Adduction.
adduction. Movement of any part of the body towards the midline of the body is called as adduction. So here you can see that the hand is moving close to the towards the midline of the body, that is adduction. So arm, when you say that the arm is adducted, it has to move close to the body. When the upper limb is abducted, the limb has to move away from the body. Okay. So coming to the hip adduction. So first picture you can see that the hip is abducted and the arrow is showing that it is moving close to the body, and the second picture shows hip adduction. Okay, so second picture shows hip adduction. Then for the fingers, you can see this black color line indicates the midline, and the fingers, when it move close to the midline, that is finger adduction. So that this black color line is the midline. When the fingers are moving close to the midline, that is finger adduction. Adduction. Okay. Yeah. So how it takes place in coronal plane is that, so I have told you that we have three fundamental planes in human body. It is one is sagittal plane, coronal plane, and transverse plane. Okay, so just imagine that the coronal plane actually divides the body into an anterior half and a posterior half. So yeah, so when you think, when you just move upper limb in an abduction and adducted manner, you can see that the movement is actually happening in the coronal plane, isn't it? When you abduct and adduct your body, your upper limb, the movement is actually happening in the coronal plane. So just imagine that coronal plane is dividing the body into anterior and the posterior part. Okay. So where the movement of the adduction and abduction is happening in the same plane. We have any doubt in that?
No, ma'am.
No, ma'am.
No, like the first picture, it says that it's arm adduction, but the arms are away from the midline, no, ma'am?
Yeah. So in adduction and abduction, it is abduction, it is away from midline. Whereas in adduction, it is close to the midline. But the movement is happening in coronal plane. I am saying about the plane, coronal plane. So coronal plane is dividing the body into anterior and posterior part. So the plane is passing just parallel to the body, right? So the movement is happening along that plane only.
Yes, ma'am.
Just in,
Yes, ma'am.
yes, correct. So it is just
Yes,
think
ma'am.
that this is moving close and away. So the plane happening is also in that area only. So that is why it is called as it is happening in the coronal plane. Okay. Yes. So finger adduction means this black color line is the midline. The fingers are coming close together, and that is called as finger adduction. So now coming to rotation. So I have told you, still now we have studied about flexion, extension, abduction, and adduction. So just remember that we have different types of joints in the body. We have shoulder joint, elbow joint, wrist joint, ankle joint, like that. We have different types of joints in the body. So not all the movements takes place at all the joints. So we have studied these joints and movements. So all the movements may not takes place at all the joints. Okay, so that is the point. So not every movement takes place at all the joints. So each joint is different entity. So only some of the movements will take place in most of the joints. Okay. So first we are going to study about, so we have studied flexion, extension, abduction and adduction. Now we are going to study about something called as rotation. So this rotation movement is complex movement which takes place only in some of the joints. So I'll show you a GIF. Here you can see the rotation of the arm. So once again I'll play it. So look at that picture. You can see the upper limb is moving inwards and outwards, and that movement is called as rotation of upper limb. Okay, so just remember that this rotation of upper limb mainly takes place at the shoulder joint. It takes place mainly at the shoulder joint. Okay, so here you can see that the shoulder movement is actually happening at the movement is occurring at the shoulder joint, which causes the arm to move inwards and outwards. So rotation happens at the shoulder joint. It is because shoulder joint comes under a variety called as ball and socket type of synovial joint. So which I think you maybe know ball and socket joint. So that is why it is called as rotation. Okay. So now the second movement is, sorry, the second movement is circumduction. So when you look at this picture, you can see that this lady is moving her arm in a 360-degree movement. So that 360-degree movement is called as circumduction. So it is moving the arm. I'll show the GIF once again. The moving the hand in a 360-degree is called as circumduction. Again, the movement is happening at the shoulder joint. Okay, so two movements, rotation and circumduction, it particularly happens at the level of shoulder joint. Okay, so now the next movement is supination. So supination, what do you mean by supination is that it is a movement of forearm where the palm faces anteriorly or upwards. It is the movement of forearm. Actually, you can see that the forearm is placed in a way that the palm is facing upwards or it is facing forwards or anteriorly. So that movement is called as supination. So the movement, like you get something from someone, you place your palm in such a way that it faces upwards, right? When you get something from someone, so that movement is supination. Okay.
Is it the way we lay our hands while we lie down in a supine position?
Sorry.
Is it the same way, like when we lay down in supine position and our hands are facing upwards?
Yes, yes. It is the same as that we lay in supine position and the palm is facing upwards. Okay. Yeah, the supine position, when it happens in the forearm, we call it particularly as supination. Ma'am, but ma'am, this happens approximately and distally. I didn't get the question asked by Bushra. Can you please ask the question? Sorry. Yeah, if you don't have any doubts, we'll move further. So when you move the forearm, movement of forearm where the palm faces anteriorly or upwards, that movement is called as supination. Okay, so the opposite of supination is called as, sorry. So the movement of supination is called as pronation. It's just like the way we have studied in prone position. The movement of forearm where the palm faces posteriorly or downwards. Okay, so in this first picture, you can see that this is the forearm and the palm is facing upwards. Whereas in the third picture, you can see that this is the forearm and the palm is facing downwards, and that movement is pronation. It is equivalent to the prone position which you have studied already. So we have two movements happening in the forearm mainly. One is it happens only in the forearm, and the movement is happening at a joint called as radio ulnar joint. Okay, that you will study later. So this movement where the palm is facing upwards or anteriorly, which is the supine movement or supination, where the palm is facing downwards or backwards or posteriorly, the movement is called as the pronation. Okay. So my question to you is, what is the first movement shows?
Supination.
Supine
Nation. And they
Supination.
actually don't say supine position. The movement is supination and the position is supine position. When somebody is asking you what is the movement, you have to say it as supination only. Yes. The second movement, second picture, what is the movement?
pronation.
Pronation. It's pronation. Okay, so hope you get it. So first picture, this
Yes,
you
ma'am.
can see the palm is facing anteriorly, so it is in supine movement, and it is facing for backwards in the second picture, and that is pronation. So now the last two movements, something is called as elevation movement, where a part of body is lifted upwards. So it is a movement where a part of body is lifted upwards. So just like closing of the mouth. So here you can see that the mouth, when mouth is closed, there is a bone present here which is called as mandible. It is called as mandible, and the mandible is moving upwards to cause the closure of mouth. So that movement is called as elevation. So movement where a part of body is lifted upwards is called as elevation. And one of the example of elevation is closing of mouth. Okay. So when there is an elevation, there is an opposite movement which is called as depression. And depression means just like the opening of mouth. So here you can see that the mouth is opened when the mandible is moving downwards. Okay, so mandible is pushed downwards, and that movement is called as depression. And what is happening in depression? There is opening of mouth. Okay, so don't think that opening of mouth is elevation. So always remember, closing of mouth is elevation and opening of mouth is depression. Okay, so when you lift any part of the body upwards, it is elevation. When you push it downwards, it is depression. Okay. Yes. So these are the movements which we have studied. So we'll see the glimpse of it once again, because it may be confusing if you hear it for the first time, because you think that all the movements happens at different parts of the body. It's not like that. So some movements only takes place in most all the so many joints are present in human body, just like shoulder joint, elbow joint, hip joint, ankle, wrist, like that. So many joints are there. So not all the movements takes place in particular joints, because joints we have classification. So based on the classification, only the joints have movements. Okay, so now what I have told is to make you familiarize with the names of the movements. Okay, so don't just think that all the movements, all the joints have flexion or all the joints have extension. Only some of the joints, only some of the joints have flexion and extension. Okay, not like that. Rotation, circumflexion, everything. So the first movement we have studied is flexion. So flexion, whenever there is flexion happening, always remember that it is a bending movement. So what happens in bending movement? Two surfaces come close together and the angle of the joint is reduced. Okay. Yes. For a shoulder to undergo flexion, it has to move anteriorly. And for a knee joint to undergo flexion, it has to move posterior. Yes. Coming to extension, it is the opposite of flexion. So what happens? There is an increase in the angle of the joint. Okay. So for a shoulder joint to undergo extension, it has to move backwards or posterior. And in
Posteriorly.
trunk, forward bending is flexion, and when you bend it backwards, it is extension, and the
Extension.
joint movement is happening at vertebral level.
Vertebral
Always
joint.
keep that in your mind. It is not hip joint, it is not shoulder joint. The movement is happening at vertebral level.
Vertebrae joint.
Yes. So this is the flexion of first picture shows the flexion of knee joint. To undergo extension, it has to move anterior.
Anterior.
Now coming to abduction and adduction. Abduction means moving it away from the midline of the body,
Midline.
and adduction means
Towards the
Towards the
Towards
body.
the midline.
adduction means moving it
Midline.
towards the midline of
Midline
the
of the
body.
body.
Okay, so coming to finger adduction, when you move the fingers close to the midline or the middle finger, it is adduction. When you move it away from the middle finger, that is abduction.
Abduction.
So this is rotation movement. So you just keep it in your mind. Definition, there is
Forearm.
no definition. Rotation is happening, and that movement mainly takes place at the shoulder joint. When you look
Shoulder
at this, you
joint.
can see that the limb is moving inwards and outwards.
Outwards.
So next one is circumduction, where the limb is moving in a 360 degree. So just remember
360
360
degree.
degree when it undergoes a movement, it is circumduction. Okay. Now coming to supination, it is a movement of forearm where the palm faces anteriorly or upwards, and the opposite of supination is pronation, where the palm is facing posteriorly or downwards. Okay, so the first picture shows supination where the palm is facing upwards. Second picture shows pronation. So when the question is about position, it is supine position and prone position. When the question is movement, it is supination and pronation. Okay, so you have to think about that difference. Yes. And then the last two movements, so many movements are there, only this basic movements are needed for you. Elevation, when you lift the body upwards, it is elevation. One of the example is closing of your mouth. And the opposite of elevation is depression, where the movement is happening opposite. The body part of the body is pushed downwards. And that is example is opening of your
Opening
mouth.
of mouth.
Okay. So if there's this much is clear, we'll move on to the question answer session.
Yes, ma'am.
Yes, ma'am.
So what is
Yes,
this
ma'am.
plane?
Coronal plane.
Yes, coronal plane. So coronal plane where the body is divided into
Anterior.
very good. The body is divided into anterior and posterior parts. Then the second picture shows
Sagittal.
Sagittal plane.
Third plane.
Sagittal.
it is sagittal plane or mid sagittal plane
Mid
where the body is
body is
divided
divided
into
into two
right
equal halves.
Equal right and
So if it is equal halves, it is mid sagittal.
It's Sagittal.
If it is unequal plane, it is.
Yes.
Sagittal.
If it is unequal, it is sagittal.
Sagittal.
So what is the second picture? The third
Transverse
picture.
Horizontal plane.
Transverse plane,
Horizontal plane. Cross-sectional plane.
horizontal plane or
Cross-sectional plane.
plane. Okay, so that is very important because in some texts they may mention it as a horizontal plane alone or cross-sectional plane alone. So you have to keep in your mind that all these are the same things. Okay. So these three
Yes,
are the
ma'am.
basic planes of human body. Now, approximation of two surfaces of the adjoining part is called
Flexion.
Flexion.
approximation of two surfaces of the adjoining part. Adjoining
Flexion.
part.
Flexion.
It is
Adduction.
flexion. Yes, it is
Flexion.
flexion. It is not adduction. Adduction is moving the body close to the midline. That is adduction. When you keep the two adjoining surfaces, that is why adjoining surface is important. When you keep the two adjoining surfaces close together, it is flexion.
Flexion.
So what is this movement?
Adduction.
What is that?
Abduction.
The Adduction.
Abduction is away from the body. When it is towards the midline,
Adduction.
Adduction.
it is
Adduction.
adduction. It is the adduction of the arm towards the midline of the body. Just look at the arrow. The arrow is moving towards the midline. So that is adduction. Okay.
Adduction.
First picture, what is the first picture?
Supination.
Supination.
First one
First
supination,
picture is
second pronation.
Impronation.
first picture is pronation, supination, and the second picture shows okay. Yes. So that is all about today's class. So please do keep in your mind the fundamental positions, fundamental planes of the body. Sorry, I have somebody. Ma'am, this happens. Personal dystrophy, adduction or abduction. You asked about which one, I didn't know. So if this was, if the question was about the last picture, just I'll show that.
Yes, ma'am.
Yes. So this picture, actually the arm is in abducted position, but the arrow is pointing, it is mentioning that towards the midline of the body. So when it is towards the midline, it is adduction. So if it is away from the midline, it is abduction. So keep that in your mind, and elevating, lifting the body upwards is called as
Elevation.
Elevation.
elevation, and when it is pushed downwards, it is called as
Depression.
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 depression. Okay, so all these are the fundamental movements. There are so many other movements happening in the body, but this much is needed for you to study about your study in your first year. Okay, so many other movements are there. You just refer and ask me if you have any doubts. Okay.
Yes, ma'am.
Yeah, so I'll be giving you the PowerPoint. So please, if you have your textbooks with you, you can refer the textbooks. Or if you need the PowerPoint, I'll share it to your coordinator. Please get it from them. So I prefer you to read the textbooks. Okay. So rather
Yes,
than
ma'am.
depending on the PowerPoint, please read the
And who's
textbooks. Then
selling
only
textbook, ma'am?
actually, here in our colleges and all, we prefer BD Chaurasya because
Yes.
BD Chaurasya has all the things in a context way, so it is easy to understand, easily understandable, and easily you will get through it. Whereas other textbooks are a little bit difficult to follow. I prefer you to read BD Chaurasya. So what the thing is that children, I want all of you to read the textbook, then only you will get that reading habit.
Yes,
Okay, so
ma'am.
don't just depend on the PowerPoint or like that. Just I want all of you to read the textbooks, make notes from the textbooks. Read the textbooks and make notes from the textbooks. That is the basics of MBBS, where you have to read the textbook and make notes. Okay, so that will be the best option if you ask me. But if you don't have textbooks, you can rely on my PowerPoint. Okay, so I have only
Yes, ma'am.
basics mentioned in the PowerPoint. So I have so many Hager's for discussion all the queries. Yeah, okay, all right. So you can so with the recordings of the previous lectures and all, please ask the coordinator. If you have any doubts, you can ask. Is there any doubt in today's class?
Ma'am,
Sorry.
from the extension.
Sorry. I didn't get the question. Can you please be louder?
Ma'am, this is has 4 volumes, along with journal anatomy.
Your voice is breaking. So you can buy BD Chaurasya General Anatomy textbook. A handbook is there, a small textbook. A handbook is actually there. That is only needed for you. So just keep reading the General Anatomy handbook. So you'll get more information from the textbook. Okay. So in
There's a
classes, we
doubt
are
from
already
last
giving
class, may I ask?
sorry.
There's a doubt from last class we had, may I ask?
Yeah, you can ask. I actually don't. Jasmine madam took the class. You can ask if I know that I'll answer. Please ask.
Ma'am, we read about plexus, that they are the braided structures resulting from network of nerve fibers. So may you please give an example of such a network in our body?
Yeah. So there are so many nerve plexus in human body. So if you know that there is a nerve plexus present in the actually in the shoulder region, and which is called as the cervical plexus. Okay, so there is something called a cervical plexus. There is something in the lower part of the back, which is called as lumbar plexus. So you might have heard that when you get older, you get backache. When your parents may have told you that I'm getting backache when I lift something weight from the ground or like that. So all these backaches and the shoulder aches in old ages is because of the malfunctioning of this nerve plexus. So nerve plexus are present in all parts of the body. To be more specific, it is present in the cervical region, actually in the shoulder joint, which is called as cervical plexus or brachial plexus. You just Google it and see what is brachial plexus. So you will see the things, nerves. Sorry. Yeah. So there is another plexus also called as lumbar plexus or also sacral plexus. So many plexus are there.
Okay, thank you, ma'am.
So if it is up, we'll wind up the class. Yeah.
Ma'am, for
Yeah,
first year
sorry.
of MBBS, we only need BD Chaurya General Anatomy volume, na ma'am?
No, for
All
completing
four.
an MBBS, it's not just general anatomy. You have to buy 3 volumes, which is upper limb, lower limb, head and neck, and abdomen. Which we have studied. No, these 6 regions.
Yeah.
These 6 regions, they have mingled it and they have made it in a 3 textbooks. Upper limb and lower limb, one textbook. Head and neck, and brain, another textbook, and abdomen, thorax, another textbook. So you have to buy 3 volumes of textbooks along with the general anatomy textbook.
Okay. So,
Okay,
ma'am, I have
ma'am, thank you.
seen that it have 4 volumes, so that's why I get confused.
Yeah, 4 volumes are there. Yeah. So in some textbooks, and what happens is that they'll split the head and neck into head and neck is one part and the brain is another part, neuroanatomy like that.
So, ma'am,
Okay, ma'am. Thank
we
you.
should buy all the 4 volumes.
Yeah, yes, you have to buy all the 4 volumes. So I would prefer that you better ask your coordinator which textbook is followed in your universities and buy that textbooks. Okay.
Okay.
So
And
don't
ma'am,
just buy.
they also said that we have to buy the Netter's Atlas of Human Anatomy.
Yes, yes. So it is better to buy the Netter's Atlas because so many things, which the diagrams and all, which will not be there in the textbook. So it is better to buy the Netter textbook so that you will get an idea of with this organ is present in this part of the body like that and all. You'll get an idea. So it is
But
better to buy the Netters. If you have a PDF of Netters, that is good enough. Okay, no need to buy the textbook as such.
but ma'am, there are other editions also of Netter's Anatomy, like international edition,
No, the
regional edition. So we don't know. We should
yeah.
buy, ma'am.
International edition is not needed actually. The Netters is actually an international textbook where Indian edition you can buy. Indian
That
edition of Netters you can buy.
in that we saw that there is a regional edition also, regional and international. We
Sorry.
regional edition and international edition.
Regional edition you can buy.
Okay, ma'am.
Excuse me, ma'am.
The same only. The contents are all same only. Only the difference is the authors. International edition is by international authors, which is then converted into Indian edition by Indian authors. But the context and all same only. You can buy regional edition also.
Ma'am,
Yeah.
ma'am, in the first class, as you discussed about the subdivisions of anatomy, you forgot telling about the living anatomy and experimental anatomy. Can you please brief that up?
Experiment anatomy is it means that something we do experiments in the lower animals. For example, it was actually conducted in previous years, late years. Okay. So where they'll take animals from the wild and they'll dissect these animals and they'll do so many experiments in that. So that anatomy was experimental anatomy, and the living anatomy is that what you study in a human living body. Okay, so in a living body, when some patient is coming to you and that patient is saying that I have a problem in the lungs, so then you're looking into the lungs of the patient, not by dissecting, just by inspection and by palpation and all. So that is what is mean by living anatomy, the functioning of the heart, the functioning of the lungs, the function of the kidney, everything, all the processes will come under the living anatomy. Okay.
Okay, ma'am.
So
So
that is living
experimental
anatomy.
anatomy is only about the animals. The dead
Yes,
animals.
it is mainly conducted in lower animals to study about the changes in the muscles or to do. So, for example, before doing heart transplantation, all these things were done in lower animals in previous years. Okay, so doing that experiment using dissection is called as experimental anatomy, whereas living anatomy means the normal functioning of the body, the function of the brain, function of heart, how is it pumping the blood, and the kidney, how is it producing the urine, all that those things will come under the living anatomy.
Okay, thank you, ma'am.
Okay. This class is actually important. So please
Excuse
do
me,
learn
ma'am.
about the planes and the movements. Okay.
Excuse me, ma'am.
Sorry.
Ma'am, you told about the surface anatomy and like living anatomy is also there. So what's the difference between both?
It's actually dealing with the process of the heart, the functioning of the heart. How is it pumping the blood? How is it producing? For example, heart, how is it pumping the blood? And when you take the kidney, how is it producing the urine, like that will come under the living anatomy. Okay. So whereas the surface anatomy is you're looking to the through the surface. That is surface anatomy. Both are different.
Okay, ma'am.
Okay. Yes. So we'll wind up today's class. Please do read this. The next class is also mine, which will be mostly on Friday, I think. So that class will deal with the little bit higher aspects of anatomy. Okay. So please do read this class. Then only you'll understand that class. Yeah. Thank you so much, children. Have a good day. Thank you.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.
Good evening.